Hello subscribers, um welcome to my channel. So today we're going to look at cholera. Okay, so cholera is an acute infectious disease caused by Vibrio cholerae, characterized by copious rice watery diarrhea, projectile vomiting, muscle cramps, severe dehydration, and fascicular collapse. So in this definition, what you should know is that it is infectious and it is caused by Vibrio cholerae, and you also mention a few characteristics, okay, such as projectile vomiting, muscle cramps, severe dehydration. Then you are done with the correct definition. So the incubation period is from few hours to 5 days. That is the incubation period of cholera. Transmission through oral fecal routes, through ingestion of contaminated food or water. So cholera is transmitted through oral fecal routes, eating food that contains feces, and also ingestion of contaminated food or water which is not clean, okay, water from the wells, okay. Sometimes in the wells they throw some rubbish that can contain harmful microorganisms and affects our immunity. Alright, so causative organism. The causative organism of cholera, it is Vibrio cholerae. So there are two types, biotypes, namely classical cholerae vibrio and hemolytic elder vibrio. So these are the biotypes, but the causative organism of cholera is the Vibrio cholerae. Okay, for your own information, just know this: classical cholerae vibrio and hemolytic elder vibrio. Okay, yeah. So characteristics of Vibrio cholerae: one, it is coma shaped. Okay, so it looks like a coma. Two, aerobic. It's able to survive in an environment of oxygen, and it's able to multiply very fast. 3, gram negative. There are two types of bacteria, which one, they are gram negative and the gram positive. So Vibrio cholerae is it's falling under gram negative bacteria. Okay. 2, it's non-spore forming. Alright, those are the characteristics. It doesn't form any spores, so it is very easy to be killed. Alright, 4, it is mortal. This is number 5 here. It is mortal, possesses both flagella and somatic antigen. So flagellas, they help in the movement of the bacteria. Alright, so it is able to move. Okay, should be number 6. It's killed by heat of 55 degrees Celsius. Alright, and by phenolic and hypochlorite disinfectants such as jig. Alright, so it's able to be killed by heat of 55 degrees Celsius and also by disinfectants such as jig. Alright, and okay, can survive in aquatic environment for extended period of dormant state. Alright, so the epidemiology, the area where cholera outbreak is mostly common. So cholera is a disease of low socio-economic groups living in unsanitary conditions with poor health services, unsafe water supply, inadequate or absent sewage disposal. It is common in Asia and Africa. Infection spread from contaminated feces and water. Other potable food includes milk, cooked food, and washed fruits and vegetables. So cholera is common in those socio-economic groups. Alright. And this is a result of unsanitary conditions with poor healthy services. These people do not have clinics nearby, right? And the health services are poor there, okay? So it also comes due to unsafe water supply. If we talk about low socio-economic groups, these are groups that are poor, right? Or countries that are poor, or continents that are poor, that's regarded to be poor. For example, we may give an example of a developed and a non-developed country, or developed or a developing country. Let's say, for example, in Zambia. Zambia is a developing country, so this country does not have uh, enough healthy services to treat this condition. That is why they suffer from this outbreak of cholera. Okay, yeah. So it is common in Africa and Asia. These are two continents where this condition is common. So infection is common spread through feces and water. Ingestion of feces and water. If we say ingestion of feces, we're not talking about taking feces and putting them into our mouths. No. Sometimes we may eat food that contains feces, or maybe we forgot to wash our hands after using the toilet, and then you go and eat the food. That means that you've eaten feces. Alright? That's how this condition comes about. And also it is common in other portable foods includes milk. So it is very important to warm milk. Make sure you boil it and then you drink it, because milk can contain microorganisms. Okay, cold cooked food and washed fruits and vegetables. So it is very important to wash fruits and vegetables, yeah, with vinegar. That's the solution that I know that we mostly use in washing vegetables. Vinegar is very, very good. Alright. So the pathogenesis, the Vibrio cholerae remains in the gut and does not penetrate into the bloodstream. So it remains in the gut, it doesn't penetrate the bloodstream. Okay, that is very good. It adheres to mucosa of the stomach, of the intestine, by both outer membrane protein and flagellar adhesion. So the Vibrio cholerae does not penetrate through the bloodstream, but it adheres to the small intestine, alright, by both outer membrane and protein and flagellar adhesion. Vibrio cholerae produces enterotoxin that causes excessive fluid and electrolyte loss. So it releases some harmful toxins that facilitates an absorption of sodium chloride and potassium and bicarbonate. Therefore, results into loss of these electrolytes. Yeah, yeah. So this is the summary. Just a quick summary. All right. Signs and symptoms. Number one, evacuation phase. So this is a question which will come as explain the signs and symptoms according to the phases. Okay, so if they ask you that, you write evacuation phase and you explain what is found in evacuation phase. You write collapse phase, you explain what is found in collapse phase. You write recovery phase and you explain what is involved in recovery phase. So if they ask you now general signs and symptoms, you just pick from any of these phases, then you list down. Yeah. So now this one, let's go by phases. So evacuation phase, not to acute onset of diarrhea, which initially contains fecal matter, but later becomes watery with flake or white described as rice watery stool. So evacuation phase is simply initial phase. So when this person is getting this infection as it progresses, in the initial phase, the fecal matter The, the diarrhea initially contains fecal matter, but later becomes watery. Okay, and it is described as the watery stool. Yeah. So initially, the diarrhea contains fecal matter. Then, as it progresses, it becomes rice watery stool. Okay, that means that the infection has progressed. Yeah. So number two, projectile vomiting may be present. So projectile vomiting is due to irritation of the gastrointestinal tract, alright, by the enterotoxin that are produced by the Vibrio cholerae. Alright. Number three, severe dehydration due to diarrhea and vomiting. So dehydration is coming up due to diarrhea and vomiting. This person is both vomiting and having diarrhea. So that is where dehydration is coming from. You look pale, alright. Yeah, the lips will be dry. All those are signs of dehydration. Yes, yes. Okay. So we go on the next phase. Collapse phase. So the collapse phase, this includes muscle cramps due to loss of electrolytes. So the body is made of muscles, and if the electrolytes are lost, these muscles becomes weak. Therefore, the person will not have power. Okay, and these muscles requires electrolytes so that they can be of good. I can say so that they can have power. They must be supplied with water and the electrolytes. Okay, so in this collapse phase, muscle cramps due to loss of electrolytes. Okay, so there will be muscle cramps due to loss of electrolytes. Then number two, metabolic acidosis indicated by sign of air hunger with deep, sometimes rapid breathing. So metabolic acidosis will be there, indicated by air hunger. So this person will be breathing deeply and rapidly because of the metabolic acidosis. Alright. Hypovolemic shock due to vesicular depletion leading to vesicular collapse detected by hypertension, tachycardia, and pulse may be impalpable at the wrist. Cold creamy skin, oliguria. If no intervention, shock can complicate into acute renal failure and death. So there will be hypovolemic shock. Okay. So this hypovolemic shock, it is characterized by signs of shock, which is cold creamy skin, tachycardia, okay, cold creamy skin, tachycardia, and hypertension. These are the types of shock you should also remember to put in this explanation of hypovolemic shock. It is due to vesicular depletion leading to vesicular collapse. Okay, yeah. So this hypovolemic shock can complicate into renal failure, and if someone has renal failure, they can die. So that is the reason why this disease it is notifiable. Okay, yeah. Then recovery phase, patients improve and the signs and symptoms decline. Okay, so this person is saved and he or she is rehabilitated. Alright. So next time we are going to do management. Thank you. Don't forget to subscribe. Yeah, let make this audience be big. Thank you very much.